Hello, I'm Denise Hill. I love sharing stories of my experiences with celebrities, politicians, some of your favorite musicians and artists, but most importantly, I love sharing the stories of everyday people. Their lives serve as opportunities to inspire, empower, and educate. It is my honor to share the stories of those who fought the fight against breast cancer and won. The So Alive Project is all about sharing the stories of survivors and caregivers. Whether you are in the fight, a survivor yourself, supporting someone who is in the fight, or just want to be informed, my hope is that this story will bless you. Please make sure you subscribe to this page or set your notifications on all social media so you don't miss one. I am at The Denise Hill. One of these stories just might change your life. I'm Denise Hill, and this is the So Alive Project. I'm here with Dr. Rahul Singh. How are you?
I'm very good. How are you?
I'm fabulous. You're over at Inova Fairfax Hospital?
Fairfax and Mount Vernon, correct.
And Inova Mount Vernon Hospital. And you are a hematologic oncologist.
Correct. Hematologist and oncologist.
All right. Now tell everybody what that means.
What that means. So I like to tell patients and everybody I'm a blood and cancer doctor.
Do they go hand in hand?
Yes, there's a overlap in a lot of different areas. A lot of blood diseases end up being cancers like leukemias and lymphomas, and that's how it bleeds over into oncology.
Got it. Of course, with the So Alive Project, we're celebrating the lives of breast cancer survivors and telling their stories in hopes that others can be inspired and encouraged as well as educated. But we're also talking to caregivers. And I think at the top of the list of caregivers is definitely the doctors who see those who are challenged by breast cancer. So thank you very much for being a part of this.
No, absolutely. It's my pleasure to serve. That's all we do.
So this might sound like a crazy first question, but what is breast cancer?
So breast cancer is just a disease that originates from the breast where your body, its cells that are normal mutate to do harm to the body, so, particularly in this case, the breast. So
when you talk about the breast, I've heard people say they found things in their armpits. And so where does it end and begin?
Right. So it originates in the breast, can be anywhere in the breast, and then everything in our body drains to lymph nodes. And those lymph nodes that drains from the breast is usually under the arms, and we call that the axilla. But that's when people say they find things under their arms, that's draining from the breast.
So that goes into one of my first questions. I don't know if you want to be a myth buster or not right now, but we hear a lot about women's bras and underwires actually being the cause of a lot of these breast cancer cases. Is there any truth in that?
There is. I don't want to be a myth buster, but that's not the truth. No.
Where do you think that came from then? Just an industry wanting to sell something other than underwire bras?
I don't want to speak to that, but there's a lot of misunderstanding about how to identify something that's abnormal in one's body, and it's easy to chalk it up to common things that we may think, such as the brassiere that's there causing irritation or something.
So then what does cause breast cancer?
So a lot of it is independent of any risks, meaning, unfortunately, you just develop this problem on its own. But there is a good portion that is genetically inherited that increases a woman or a man's risk of developing breast cancer.
It's very interesting that you said or a man's, because I know at least for this project we find it very hard to find men who are willing to admit to being a breast cancer survivor. When it comes to your practice, how many do you see?
Oh, we've seen several men with breast cancer. Obviously not a common finding, but just as much at risk for developing breast cancer.
So many different types of breast cancer that I'm hearing out there. Can you talk to how many various types and varieties there are, and are they more prevalent among particular cultures and races than others, and all of that?
Right. So in the world of breast cancer, we try to break it down into three major types. there are a lot of subsets, and when you can get into a lot of molecular and medical jargon, but for treatment purposes, there's 3 types of cancer, and we use markers to identify these types. So the first type is what we call hormone-positive breast cancer. And that's probably the most favorable type of breast cancer because a lot of people can get away without treatments such as chemotherapy and just hormone pills to take. Then there is a whole nother subset of people who may be having a certain receptor positive called HER2/neu. And that itself is a different type of breast cancer. About 20 years ago, it was treated as an aggressive type of breast cancer, but luckily through the advancements in medicine, we have drugs that can target that specific receptor. And then there is a type where you don't have any of these mutations or receptors, and we call that triple negative breast cancer. And that, unfortunately, we're still trying to research more about, but right now all we have to offer in that situation usually is chemotherapy. And in fact, that's the subtype that we see more commonly in African American females.
So I'm assuming since not as much is known about that one, that has the highest mortality rate?
It's tough to say the highest mortality rate, but overall I would agree with you on that. The thing is it goes unrecognized, and then when it spreads is when you start to see more problems.
Wow. Okay. So I'm going to ask you a question, and I don't want it to come out offensively because I mean no offense by it. I'm trying to simply grab every single area of this possible. But whenever I bring up holistic treatments to doctors, they kind of default to their medical expertise, which is it's completely understandable. But do you feel that there is any value in any of the holistic approaches that are coming out?
So I'm, by training an allopathic medical doctor, but we train ourselves to learn and teach and practice by big medical studies that prove whether there's a survival benefit or not. That being said, I've never been someone to shy away from supplementing treatment with other methods of treatment. So, it's hard for me to put all my stock in belief into holistic medicine as its primary treatment for someone's cancer. But in addition to what we're doing, I don't find that there's any downside or detriment to someone for doing something like that.
Thank you for not being offended.
No, definitely not. If that's it, then that's not bad.
Woo! I mean, some folks, they really can get up in arms about, don't look at, no, it's not about just the diet. It's not about just this. But, then you have these tremendous cases that come out that say,
right.
I was treated like an entire person. They talked about my fitness. Right. They talked about my diet. They talked about my faith. They talked about the medication as well. So do you feel that you're that type of holistic doctor?
Absolutely. I think it's more than just one thing when you're dealing with such a big thing like cancer. It's more than just the medicines that we give. It's a family approach. It's a faith approach. It's other things that drive someone to being in a better place. I think it all contributes to someone beating cancer.
So I've talked to a lot of survivors and asked them about kind of their darkest moments and what they use to pull themselves out and be able to continue in this fight. I can only imagine as a doctor seeing patient after patient after patient and probably losing a few of those, that you've had a few moments where you just kind of had to put your head in your hand and feel some kind of way. Is that a fair assessment?
Oh, that's more than a fair assessment. Yeah. It's a lot of people ask me, why did you get into oncology? It's such a sad field to be in. But I think it takes a certain personality, but also it takes people to understand that you cherish every moment that you have on this earth, and you try to give more time to people who believe they don't have time. And in that time, you share a lot of experiences, share a lot of emotions, and I've shared a fair amount with a lot of my patients. Yeah.
What do you do when it's just Dr. Singh by himself to kind of pull himself back to a place where you can continue to impact lives in a positive way?
Yeah, that's a great question. I think I always rely on my family, faith to get me shining in the right direction and being there to be able to help other people.
That's great. That's phenomenal. Can you talk to why it is that women who are under 35 are still having challenges getting diagnosed, even getting tested?
Right. So our guidelines aren't there for people younger than 40 to routinely be tested. So a lot of times women will notice a lump in their breast, and either they may not even notice it because they're not doing examinations on their own, and it gets carried away to the point where maybe the skin gets red. They think they may have had an infection, and then before they even know it, it's already spreading. And then when we see them, they're already quite advanced. I think awareness isn't promoted enough, or we need to do a better job of promoting awareness on many different levels, notifying that women younger are just as maybe at risk for developing breast cancer, or that they have a family history and, they're not being identified properly to be screened earlier.
So is that the key? If you have a family history, that they're more willing to test you, to take you seriously? I mean, what's the conversation among the medical community?
Right. So a lot of people think, it's just if my parents had cancer or my mother had breast cancer. But when you see a true geneticist, they actually draw a whole family tree out and look and see, maybe it was your aunt that had colon cancer. Maybe it was a second aunt or a third cousin that has a different type of cancer. They're all linked somehow, some way, but without talking about it in the family and being open about it, you may never know, this such and such aunt had this type of cancer. Maybe that might affect me. A lot of times I do see that we just, when you take a detailed history, you do find out a lot more.
You just said something huge. They're all linked in some way?
Yeah. Well, we try to. Maybe they're not, but more often than not, when you start digging, you may find a lot more than you imagine.
Wow. Had not thought of that, because the media and marketing around breast cancer is if your mom had it, then you're at risk for that. And no one really talks about, hey, there's this mutation in your body and your body is connected to your body and it could show up somewhere else in some other area. That's huge.
And it could skip a generation. So it's not just about direct relationship. So that's important.
So when should moms begin having conversations with their kids about checking themselves out?
Oh, that's a great question. I think they have to be comfortable. So at least I would probably wait till 18. I wouldn't probably put that burden on somebody before that.
Unless, of course, they're witnessing their mom or dad go through.
Correct. So with the caveat being, if there's a strong enough family history of breast cancer, and particularly carrying a mutation such as a common one called BRCA, BRCA, conveys a very strong family history of breast cancer, and as such, you should be having conversations earlier.
And heaven forbid you get a diagnosis. What's some of the advice that you can give to those who are facing this right now?
So in that particular situation, if they carry a BRCA mutation, it increases the risk for not only breast cancer, but also for ovarian cancer. And so it's a little bit tricky. Before, the plan was to take out women's breasts and ovaries. But now research is showing if we can get around that, maybe there's certain medications that we can use, or just screen earlier to look for these possible pre-cancerous lesions.
Okay, so there's a woman, brand new patient that comes to your office next week, tomorrow, whenever, and she has this diagnosis that she's faced with. What's the first thing you tell her?
First, I want to get to know her. So I first ask about her life. I don't want to focus on the cancer just yet. It's more than just that. So I get to know her first, and then ask how much does she know about what's going on. And then, if there's family present, I like to get everybody with her permission involved. And then just understand the level of they know about what they're dealing with. And then I start to lead in with the information I have, the information we need to gather. And then ultimately we talk about, well, what's the next steps? And it's hard to address a long-term vision because patients aren't always thinking about it. They need to get through step by step where they are, instead of cluttering their mind with a lot of information, which is not going to process all in that one setting. A lot of times there's a lot of shock that needs to dissipate, and then we can have more conversation about where we're going.
Well, thank you for being a vessel to help women and men get through this challenging time in their life, and for helping folks to become survivors and actually thrive and live after a diagnosis.
I really appreciate you taking the time to talk to me. It's my pleasure. The more that we can reach out to everybody, the better for everyone.
Can you give just one last word of encouragement or motivation from a caregiver to those who are challenged right now, or even those who are other caregivers for someone who's challenged with breast cancer? What would you say to them?
I would say that this is a fight that you're not in alone. This is a fight that we're all fighting together. And with family and faith, you will get through this, and we will get through this.
That's Dr. Rahul Singh, oncologist at Inova Fairfax Hospital and Inova Mount Vernon Hospital. Thank you so much for your time.
I appreciate it. My clinic is NovaCure Consultants, and if anybody ever needs any advice, please don't hesitate to reach out to us.
Thank you so much.
I appreciate it. Thank you so much.
My hope is that this story has helped to educate you, empower you, and encourage you. We offer all the love and support we can for those who are in the darkest of moments, and we celebrate that we're so alive for those who have been victorious and survived the great challenge they call breast cancer. Most importantly, I honor the legacies of those who are at rest from the fight. I appreciate each and every person for their willingness to share their story, and I look forward to bringing you more. Make sure to follow me on social media. I am the Denise Hill. You stay blessed.